No, it's not. With advancing technology, especially with our digital imaging, the amount of radiation a woman will get with an annual screening mammogram is very low. That being said, exposure to any radiation is linked to an increased cancer rate. However, a transcontinental airplane flight exposes you to more radiation than you would get with many, many mammograms. Or a CAT scan, and CAT scans are done so frequently that has exponentially more radiation than a mammogram. We are finding that mammograms should be done regularly, but if a woman is particularly concerned about that, and if her mammograms have been very good quality, if she is at low risk for breast cancer based on her family history and her personal history, and if she does not have overly dense breasts, it would probably be perfectly acceptable for her to stretch out her imaging interval to, let's say, 18 months to 24 months. But that really needs to be a discussion between the patient and her ordering physician. There are risks and benefits to any test, so any test before it's done should be discussed. Nothing should be a knee-jerk reaction, you have to get this. There are about 40,000 women in the United States a year who die of breast cancer. Really, the tragic ones are the ones that die in their productive years, the premenopausal cancers. And premenopausal breast cancer is much more aggressive than postmenopausal. But to be honest, pulmonary disease, lung disease, heart disease, stroke, the cardiovascular diseases, especially those that are aggravated by smoking, really have a higher mortality for our American women.
Interesting. And let me just, because there were some numbers written here as well. Stroke, 96,000 deaths, lung cancer, 71,000, respiratory disease, 67,000. All of those are ahead of that 40,000.
Absolutely. Absolutely.
Gotcha.
So, and a lot of those are preventable.
Gotcha.
So if patients live a healthy lifestyle, they don't smoke, they maintain their weight at an appropriate level, and they are very careful with their diet if they have risk factors. Also, all sorts of prevention things that should be discussed with someone's primary care doctor. Studies have shown that as long as conservative therapy is appropriately chosen and then appropriately done, that the treatment of the whole patient is the life-saving maneuver. So when we're talking about breast surgery, we're talking about local control. And some women will do perfectly fine having just the tumor removed, having a lumpectomy, followed potentially by radiation, having their lymph nodes checked, versus women who might need a mastectomy. That's a discussion that the patient will have with their surgeon to see what they're an appropriate candidate for. However, it's not the tumor in the breast which kills patients. It's the tumor that's sneaked out and has gone to lung, liver, bone, brain, or somewhere else. So that's the reason we do multimodality therapy. That's the reason we do surgery, the reason most women end up on either a pill for 5 to 10 years and or get chemotherapy, and also radiation to the breast or the chest wall. This is very different than one size fits all. It's not. Breast cancer therapy is almost like getting a designer dress for the Oscars that's made just for you. We have to look at all of you and your tumor in relation to you, all your other risk factors, plus your mental status. Some women will only be happy if they have their breast removed. They just can't tolerate the thought of that. Genetic testing also comes into play. So if a woman is at risk for being a genetic carrier of breast cancer, of an abnormal breast cancer gene, the BRCA1 or BRCA2 are the most common that we see. They're responsible for 5 to 10% of breast cancers. Then a woman actually will probably look into having both of her breasts removed, even for a small cancer. We try to minimize surgery. We try to minimize interventions, give just the right amount of surgery, just the right amount of everything else. So having your breast removed, and especially having a normal breast on the other side removed, in no way will improve your survival unless it's indicated for the tumor. Actually, we're learning a lot about body fat and obesity, so that is false. Actually, women who are above their ideal body weight have an increased incidence of multiple cancers, as do men who are above their ideal body weight, more aggressive prostate cancer in men, and a higher risk of breast cancer, particularly in our postmenopausal patients. Because fat not only is a place where estrogen is made from the male hormones that our adrenal glands secrete, but it's also very active metabolically. It's not just fat like on a chicken breast sitting there, it's active living stuff, and it's trouble. It is trouble. We really emphasize to our patients that they should be healthy and fit. We're not talking about a dress size. We're not talking about a pant size. We're talking about health and fitness, and that involves being as close to your ideal body weight as possible to really decrease your risk of both breast cancer, other malignancies, and all the other diseases we talked about, like heart disease.